Now it's your turn, and your turn to get free advice from the dentist. Dr. Mark Hyman is here, and he can answer questions about your family's teeth or maybe problems or concerns you have. The number is 1-800-807-8255. Good morning. Thanks for coming in.
Good morning, Brad.
You brought something neat. I'm not sure about it. We're going to look at that in just a second. First, let's go to the phone.
Sure.
Karen is on the line in Colfax. Good morning, Karen.
Good morning.
What's your question?
Do you think it is a waste of money to pay to fix cavities in baby teeth?
Karen, I hear that question a lot from young parents, and here's my thought. The baby teeth serve tremendous, wonderful purposes for kids, for them chewing, for their speech, for holding the position of the teeth while the permanent teeth start to come in. So I see it as small money for a huge benefit down the road. Your children get the baby teeth usually starting perhaps at 8 months old, may have them until they're 13 and a half. Usually you've lost your teeth by 12-ish, but it could be a year and a half on either side. So I think it's small dollars for a huge benefit.
Back to the phone. Cindy's on the line in Reedsville. Good morning, Cindy.
Good morning.
What's your question, Cindy?
My question is, what is available for low-income Americans that's on disability that are in need of extractions from an oral surgeon?
Yes. Sorry that you're going to lose some teeth. One of the neat things that we have here in Greensboro is the Chandler Clinic on Friendly Avenue. Dr. John Chandler donated his building, and it's for adult health. So I would call them and see what their policy is, and it's a wonderful resource that we have here in the Triad.
And again, the Chandler Clinic on Friendly Avenue.
Yes.
Okay. Hey, real quickly, I want to look at these. You brought these in to demonstrate, you know, for people who have dentures, there's something new out there.
Right. Traditional dentures, particularly lower dentures, are like horseshoes, and there's just no retention to them.
Right.
So it's difficult. As dentistry advanced, we had dental implants, which was really cool, where you could place 2 or 4 or 6 implants and kind of lock the denture in.
Right, that's
but it still would come in and out at night.
Right.
And one of the great advancements of dentistry now, Brad, this is called all-on-4.
Wow.
Where 4 dental implants are placed. The front 2 are placed vertically, perpendicularly, and the back 2 at a 45-degree angle, which engages the bone better.
Gotcha.
And then you screw in the denture.
So that denture is basically in there.
So it is in there.
Permanently in there.
Right.
And big change from this, from removal.
It's a colossal change, and somebody can have their teeth pulled and basically displaced in a day.
Wow.
So somebody can go from really dentally disabled to having their dignity and respect back.
If people want to ask about it, again, the name of it is called
It's
what?
called All-on-4.
All-on-4.
Yeah.
Ask about it.
Way cool.
Let's go back to the phones now. Mira, I believe is the name, is in Sarah, excuse me, is on the line in Virginia. Good morning, Sarah.
Hi, Sarah.
Good morning.
Go ahead with your question.
I had a root canal, 2 steps on tooth 19, and was ready for my build-up and crown with my general dentist. And when I expressed to him that I was still having pain in that tooth, like shocking pain going through, he let me know that I wasn't ready for the crown, and I have a appointment set back up with the doctor that did the root canal, and I was just wanting to know maybe what the causes could be of this shocking pain after a root canal.
Right. I'm sorry you're still having the pain. When a root canal is done when the nerve of the tooth, the nerve and blood vessel inside the tooth gets infected for whatever reason, from cavity or from trauma. We tell patients 95% of the time when you get a root canal done, that's the end of the story. 5 to 10% of the time the root canal needs to be retreated because there's still some residual infection. There's still some pus or some bacteria at the tip of the tooth. If that's done 95% of the time, that solves the problem. Occasionally, the dentist has to do an apicoectomy, which is going in perpendicularly to the tip of the tooth to take care of it. And the final possibility, and I hope it's not the case for you, is there could be a vertical crack in the root of the tooth. If that's the case, kiddo, the tooth's going to have to come out. So very probably just retreating the tooth could solve the problem. I hope that works for you.
Hope that next step works for her.
Very much so.
Dr. Hyman, thank you very much. We appreciate you coming in.
Thanks, Brad.
Neat, and again, the name of this, if people want to find out more.
All-on-4.
All-on-4. It might be a real option for people.
Really cool.
Yeah, neat stuff.